Hello, Dr. Regina Rodman here, and we are going to talk today about some of the risks with blepharoplasty. So blepharoplasty is eyelid surgery. Now, there's two different types of eyelid surgery, upper eyelid surgery and lower eyelid surgery. They're often done together, but don't have to be, and they carry separate and different risks. So upper eyelid surgery or upper lid blepharoplasty is generally a surgery that consists mostly of skin, sometimes a little muscle and a little bit of fat. But the goal of upper eyelid surgery is usually just to remove the extra folds of skin that are hanging above the eyes and causing the eyes to look a little bit tired. Upper blepharoplasty by itself can be done in the office with just local anesthesia. Patients generally tolerate it really well. They're able to just we give a little sedative, they can close their eyes, and the whole thing takes about 30 minutes. In that surgery, there's an incision made in the upper eyelid, right in the crease of the upper eyelid. This heals really, really well. When your eyes are open, you can't see it at all because it's in the crease. Even with eyes closed, you really have to look carefully to see that scar because it generally hides so well. In an upper lid blepharoplasty, what we're doing is mostly just removing the excess skin. I usually remove a little strip of muscle, and if there is some fat that's herniated out from behind the eye, I'll remove a little bit of that, but usually really cautiously because too much fat removal can lead people to have a hollowed out looking eye. After that, some careful little stitches are put in the eyelid. Those stay for about 5 days. They're removed. This generally heals really well. Lower eyelid blepharoplasty can be done a couple of different ways. What I prefer to do is what I think is probably a more conservative but safer way to do it. I go inside the eyelid, and this surgery usually is more about removing fat and puffiness under the eyes than removing skin. So the big risk with lower blepharoplasty is when it heals, and this can happen even years later, if we take too much skin, the eyelid can pull down and actually evert the eyelid or have a look where the eyelid droops and sags too much because it's being pulled down, and so it won't cover the bottom part of the eye. So that is something I absolutely want to avoid all the time. And so my approach to remove the fat is through the eyelid. One, it doesn't leave a scar on the outside, which I think is helpful, but two, it is the approach that has been well studied that is the least likely to cause what's called ectropion or pulling down of the eyelid. So that's my approach to the lower eyelid fat removal. If somebody has a lot of extra skin and they need that done too, I will often do what's called a Pinchbleph. So I'm taking just the skin, I do a little pinch right under the eyelashes, pinch that together, cut that extra skin off, put a careful little stitch in there. That also heals really, really well right under the eyelashes. We already have a little bit of a crease. It heals really nicely right in there. And this, although there is some risk of pulling down the eyelid because I'm just taking skin, I'm not taking muscle, and I'm not taking any of the septum. I'm not disrupting the septum, which is what holds our eye kind of where it needs to be. That risk is a lot lower. So risks of a blepharoplasty, like I said, from the lower eyelid, the big and scary one is that the skin gets too tight and pulls down the eyelid over time. Any surgery around the eyes, there's a risk of changes in vision. That's the terrible, scary thing that we always want to avoid, a risk of change in vision or blindness. This can happen not so much from the surgery, but from if there is a blood vessel that bleeds deep in the eye and it goes unnoticed, the pressure that it creates can actually occlude the optic nerve or some of the vessels in the back of the eye. So that is the reason we do a vision check. If the patient is asleep when we do the blepharoplasty, we check their vision in the PACU, check their vision afterwards. We follow patients really carefully. It's most likely to happen if this happens. It usually happens pretty quickly after surgery. It's like a little blood vessel that just maybe was bleeding a little bit but started bleeding a lot more later. This is super rare, but it's like the dangerous, scary thing that we always are trying to, take precaution against. Other risks of blepharoplasty, always a risk of scarring, a risk of damage to your eyelashes or eyelash loss, those are really rare. Those scars usually heal really, really well. Something that is not so much a risk, but to be somewhat expected, is dry eyes afterwards. Almost everybody says that they feel like they kind of have sand in their eyes, or their eyes just feel a little dry. Patients can use ointment, they can use artificial tears. There's a lot of things that we give you to make that better, but most people say that the blepharoplasty is not very painful, but their eyes do feel a little irritated afterwards. So that's not so much of a risk, but just kind of what comes with the territory. There's a risk that we could do damage to the eye, like scratch the cornea. I do always put in corneal shields, which are a little protector. If the patient's asleep, I always put in corneal shields, which is like a little eyeball protector to make sure that we don't damage that. That said, it's something still could happen otherwise. And those are the primary big scary risks, very rare but real. And so it's just also important to know there's different techniques to blepharoplasty, to know which technique and which approach your surgeon uses, and to have a full examination before proceeding with surgery to make sure that the surgery that you're getting is the right surgery for you.